Hello and welcome to the live session on Interventional Neuroradiology, emerging field in neurosciences. I'm your host, Dr. Fauzia and I'm delighted to have with me today Dr. Nishchint Jain, consultant neurointerventional radiology. We will be speaking to Dr. Nishchint to try and understand what is neurointerventional radiology, what is it all about, and how does it help in the treatment of neurological diseases, especially stroke. A very warm welcome to Dr. Nishchint.
Thank you, ma'am, for the kind introduction.
How are you, Dr. Nishchint?
I'm doing well. How are you?
Yeah, it's wonderful to have you with us in this live session. So, Dr. Nishchint, let us start with the role of a neurointerventional radiologist. A lot of our viewers may not be familiar with this term. So, if you can just explain what is the role of a neurointerventional radiologist in the field of healthcare.
So, neurointerventional radiologist, or basically interventional neuroradiology, is not a new field. It has been there for more than 2 decades, and it forms one of the central pillars in neurosciences.
Okay.
Field basically involves treatment of complex neurovascular or diseases that are related to blood vessels of brain, which are treated in a minimally invasive way without opening up of the brain.
Okay.
The doctor basically uses a pinhole in either the leg or the arm, and then he takes his tubes and catheters up into the brain, where we are able to perform complex vascular procedures, causing minimal morbidity to the patient.
Okay. And can you explain some of the common conditions or cases which a neurointerventional radiologist usually handles?
So one of the most common conditions that we are now handling is the stroke. So as we know, stroke or paralysis is when one part of the body stops to function. So if a patient reaches us within say a window period of 24 hours, we can go and take the clot out, and we can restore the blood supply to the brain. We also treat brain hemorrhage in a minimally invasive way. So one of the types of brain hemorrhage is called as subarachnoid hemorrhage, which is basically hemorrhage into the water of the brain. And the most common cause is one of the arteries has ballooned out. We can go and close down that balloon using these techniques. The other common group that we treat is known as AVMs, or arteriovenous malformation. Simply understood, they are tufts of blood vessels. They're cluster of blood vessels which are entangled together, and they have a high tendency to bleed. So we can go and endovascularly, we can go and occlude these vessels so that the patient does not have bleeding in future.
Okay.
We are
So
also
sorry,
sorry.
yeah, please go on, Dr. Nishchint. Yeah, please go on.
So we are also now treating uh, uh, another type of brain hemorrhage, which is called as a subdural hemorrhage, which is basically hemorrhage of the brain surface, and we can use minimally invasive techniques to that can avoid a major brain surgery for the patient. We are also treating complex spinal vascular problems where again either there is a vascular malformation within the spinal cord, or there is a hypervascular tumor which is drawing a lot of blood, and before surgery you can just go and stop all the blood supply to such a tumor.
If I am to understand correctly, this neurointerventional radiology is a minimally invasive way in which the neurological disorders can be addressed. Is that right?
Absolutely,
And
ma'am.
and a stroke is one of the major areas where the work of a neurointerventional radiologist is vital. So, are there
Absolutely.
some time limit during which the stroke patient needs to reach you before you can, do these neurointerventions on him?
So for a patient should actually reach to an hospital as soon as possible once the patient has recognized, or the family has recognized, that my patient might be having stroke. If a patient presents within 6 hours, we can go ahead and open up the brain artery if it has closed down, and we can minimize the damage that is going to happen to the brain. For some select patients, we can offer these procedures up to 24 hours. So if
Okay.
a patient has got a stroke, and the patient should reach hospital as soon as possible, and if the patient is able to come within 24 hours, then in a lot of cases, we can actually go ahead, open up the brain artery. And once you have opened up the brain artery, you can minimize the brain damage. This leads to minimal loss of quality of life in that patient.
Okay. And how soon does the patient recover?
So, in fact, in few cases, we have seen dramatic recovery. Stroke is one of the diseases where you see dramatic recoveries within the cath lab itself. So, you take a patient, he is not able to move one side of his body, you do the procedure, and just after the procedure, the patient starts improving. In fact, sometimes patient can regain complete power in the cath lab itself. In fair majority of patients, there is substantial damage when the patient has come to us. In such patients, recoveries can take from 2 weeks to 2 months. But it has been shown that once this procedure is done, majority of the patients are going to do better after 3 months of the procedure.
That's wonderful to know. And since you work with all these neurological disorders, so I get to understand that you need to work in tandem with the medical specialists, the neurologists, the neurosurgeons. Is that right?
Absolutely, this actually forms the cornerstone of our practice. All of these diseases are treated as part of a team, and we tend to offer patient the best possible treatment which we can offer. So, for example, a stroke patient is going to come into the emergency room, and the first team that is going to assess these patients will be the emergency doctors. And once we see that patient is having stroke, simultaneous calls are given to the neurologist on call, radiology team on call, as well as the interventionist on call, and we get quick imaging done. It is interpreted very quickly. The images are then discussed among the teams to provide patient with the best possible treatment. Same is with, say, a patient who has come with brain hemorrhage. Again, the patient will come with a brain hemorrhage. You get imaging of the patient done. We get the neurosurgeon on board very quickly, and whatever is the finding on the initial investigation, we tend to offer the patient the best possible treatment. Whether it is neurointervention, it can be medical, or it can be surgical treatment upfront. And all the teams continue to see the progress of the patient when the patient is actually admitted within the hospital, even though the primary treatment might have been done by the other team. So it is very important for us to give our timely inputs, but it is more important for us to actually receive timely inputs from the other teams before we go ahead and plan any kind of procedure on such patients.
Yeah. So you've talked about stroke, you've talked about AV malformations. Apart from these, what are the other technological advancements which have significantly impacted the field of neurointerventional radiology in the recent years?
So over the past decade or so, we can broadly divide these advancements into two major subheads. The first is emergence of a lot of medical evidence to support treatment by this modality. So over the last 10 years, multiple scientific papers, multiple randomized control trials have come in various peer-reviewed journals which have conclusively, beyond doubt, proven medical efficacy of these procedures. In fact, these procedures are so efficacious that we are now in a stage where we have to answer why we should not be doing emergency procedures in patient rather than why we should be doing it. The other important part is improvement in the equipment, the hardwares, and the X-ray modality that we use has allowed us to increase the spectrum of diseases that we can treat. Majority of our patients have very small hospital stay. Post procedures, patients are either kept in recovery room or in ICU maximum for a day, and we can look at an early discharge of these patients. There is minimum morbidity and mortality associated with these procedures. They are very safe, and we have now started to encompass newer diseases that were not initially treated by these modalities. So we have started placing stents within the brain for a plaque deposition within the brain. We have started placing stents on the sinuses of the brain to relieve the high pressure in the brain. We have started developing new techniques where we can tackle aggressive brain tumors in conjunction with the neurosurgeons to provide optimum treatment and relatively lower recurrence rates. We are also working on newer techniques uh, which are coming up with respect to aneurysms that make the treatment even more safe for the patients, and we tend to minimize the hospital stay further.
Dr. Nishchint, you talked about a patient recovery faster, has ICU stay is less, and the safety of the procedures. So, what would the patient expect that what his experience should be when he's advised to undergo this procedure?
So all kinds of procedures are actually different when we talk about them. So the simplest procedure that we do is known as cerebral angiogram, where we just go and look at the blood vessels in the brain. It's an about approximately half an hour procedure. The patients are generally admitted in the morning. We do the case, and after the angiogram, the patient can be discharged within next 6 to 7 hours.
Okay.
As far as elective procedures are considered, majority of brain procedures are done under general anesthesia. Again, the
Yeah.
patient will be called in hospital one day prior to the procedure.
Okay.
We do these procedures under general anesthesia. The patient, in majority of instances, is then woken up in the procedure room itself. And
Okay.
since it's a brain procedure, we tend to keep patients in ICU for a day. And if the patient has tolerated the procedure well, then we keep in a ward for a day or two just to help the patient recover. And within a couple of days, we can discharge from the hospital. Patients can get back to their normal lifestyle within a week from discharge from the hospital in case of an elective case or when the brain hemorrhages, say, not that much, not a big bleed. So recovery from these procedures is very fast. The patient can get back to their life very quickly, and the major advantages, we are not going to open up the brain. We don't open up the skull. We don't open up the brain. So the surgical morbidity to patient is very very less.
Yeah, and the patient would feel more comfortable in a minimally invasive setup rather than undergoing an open brain surgery.
Absolutely, absolutely. Patient is more comfortable. There's no doubt. It has been proven conclusively that these procedures are relatively less risky. The risk to life or risk of severe brain damage involved with these procedures is very minimal. The ICU stay is on the lesser side, as a result of which the expenses involved with the procedures is also relatively less when we talk about hospital admission and the cost involved. And the best part is patient can actually get back to their work, to their lifestyle very, very quickly.
That's wonderful to know, Dr. Nishchan. As a neurointerventional radiologist, what is the challenge which you face in a day-to-day setup?
So the
Must be
biggest challenge,
many.
the biggest challenge is basically getting our patients or colleagues to accept this modality as one of the treatment options. And the growth in field of interventional neuroradiology over last 5 to 10 years has been phenomenal. And
Yeah.
initially, the diseases that were either not treated by neurointervention or the risk involved with the procedure were thought to be high are now very safe and very efficaciously can be treated with these advanced modalities. And the biggest challenge I would say is just to get the right treatment to the right patient. Making that happen is one of the biggest challenge that we face in our day-to-day practice.
Dr. Nishchint, can you tell us how does ongoing research contribute to the development and improvement of the procedures in neurointerventional radiology?
So, as with other fields within the medical science, research forms a very, very important part of neurointerventional radiology also. Research is required first for us to validate the procedures that we are going to do in the patients. So, since these are newer procedures, these are procedures that have just come up on the horizon, they need to be validated with adequate medical research before we go ahead and do them in the patients. Research and innovation also allows us to come up with newer procedures using newer devices that make these procedures more efficacious and relatively more safe as compared to their older generation counterparts. I would like to give example of treatment of acute stroke. So we had 5 trials that came up almost simultaneously in year 2015 that actually changed the face of how we manage acute stroke patients. So once you are armed with a lot of medical evidence, it becomes very convincing. It becomes very convincing for you to even bring your other colleagues on board for offering patients newer treatment, and we are very confident when we are trying to offer these to our patients. The other thing is this also helps us in explaining the patient what they should expect out of the procedures, what will be the expected outcomes, and what are the risks involved. So once you have all this scientific data with you, it becomes very easy for you to go ahead with the procedures.
Very true.
There are few,
Yes, Dr. Nishchint.
and there are few, and in every year or now there are newer innovations that come up that can actually help us either in performing these procedures, or we are including newer diseases that can be treated in the non-invasive manner in which we treat our patients.
So when you talked about newer technology, newer innovations, are there any new exciting trends or emerging technologies on the horizon for neurointerventional radiology?
So one of the changes that has happened over the last couple of years is we were trying to first do all of the cases through the leg, and now more and more we are shifting to doing these procedures from arm. So once we are doing these procedures from arm, or it is called as a radial route, this allows patient a very early mobility. So initially we used to keep patients in bed for 6 to 8 hours after the procedures. Now patients can be mobile in about 30 minutes to an hour after the procedure. Uh, the other thing that is coming up is called as robotics in neurointervention. So this is important for the personnel involved in neurointervention. We can now perform these procedures even from a remote location. So this will probably help in future to increase the availability of these procedures to remote areas. It reduces the radiation dose for the people involved in the procedure, and definitely once robotics is involved, the precision of the procedures increases tremendously.
Yeah, that is very exciting to know. Robotics, especially in neurointervention, that is something absolutely new. Uh, Dr. Nishchint, is there any success story which you would like to share, which has made a positive impact in your patient's life? Something which changed patient's total. Uh,
One of the things with neurointervention is going to be that it is a very rewarding field with the respect to patient outcomes. Once you have your patients coming back to you and patients with good clinical outcomes, it is very rewarding for you to see such patients. In fact, we had a very tricky case couple of months back. It was a 17-year-old child, and the patient had a giant aneurysm, which is a balloon in the brain. It had actually ruptured, and the child came up in a very pretty bad shape, and we were able to place in a complex device called as a flow diverter to treat that aneurysm. The patient was then also treated by the neurosurgical team for placement of a shunt. And after a month stay in the hospital, the child has actually made a remarkable recovery. He's back to his school. There is no neurological deficit. He's absolutely fit and fine, and it probably is one of uh, how can I put it? It's a tremendous case with respect to the patient outcome, and it is very gratifying to see such patients coming back to you. And this is actually one of the joys associated with the field.
yeah, that was really awe-inspiring, Dr. Nishchan. Thank you so much for this enlightening conversation. Thank
Thank
you
you
for
so
joining
much.
us in the live session. Thank you once again. We are also streaming this out as a podcast as Hello Apollo on Spotify, iTunes, Google Podcast, Amazon Music. Thank you, dear viewers and listeners, for tuning in and making us grow in such large numbers. To our listeners and viewers, if you need any professional help, you can reach out to us through the details mentioned below or through our social media channels. To know more about healthcare and our upcoming episodes, do follow, subscribe, share this message to your family, friends, loved ones. For any suggestions regarding the topic which discussed today, DM us on a social media handle, Apollo Hospitals Delhi. We'll be happy to connect. Till then, stay happy, stay safe, and stay healthy. Thank you.